around the lesion. Now, our data from the mid-90s showed that we could be very accurate in excluding cancer. We had a 98% negative predictive value. But in any disease with low prevalence, a predictive value will be relatively high. We had a 83% positive predictive value in finding ovarian cancers, and the cancers that we did find were stage 1 or stage 2. Now, I must admit that these lesions do show significant variation in different studies, and some studies which included pre- and postmenopausal women showed various statistics. If one uses mostly postmenopausal women, the data, as you can see in the study on the right, shows much better specificity and improved positive predictive value. So, is color Doppler clinically useful? The answer, of course, I think it is very useful, and it's useful as an adjunct to abnormal morphology. And we really feel that what we're looking for are clusters of vessels in morphologically suspicious areas. Now, the advantage of 3D allows us to see the vessel density and their relative branching pattern, as well as their vascular caliper. And so 3D is in fact helpful in looking at some of these tumor vessels, and I've shown you already that with tumors there's a cluster of vessels. The vessels have very abnormal branching patterns. And so this is one of our first images showing 3D in a tumor, in an ovarian tumor here, and adjacent to a patient with a cyst that has very few vessels surrounding it. So this is the niche type 3D determination, and we can see again the difference between tumors and the vessels in a cyst. With 3D we can see the papillary excrescence, and we can see sometimes the vessels inside the papillary excrescence. And here's a patient that has a solid area in this cystic lesion with a large feeding vessel. And this is at various degrees of rotation. Now I hope to show you this on 3D and distinguish it from a benign endometrioma. Now this is a 3D with vessels, as you can see here, that are very small. They don't course to the center, but very evenly spaced. Again, as you can see here, this is a benign lesion of the ovary and endometrioma. This, on the other hand, has a large feeding vessel going to the center of a solid area, which represented an ovarian tumor. And we can be very specific in differentiating the two. This is a 3D showing a volume of a metastatic lesion to the ovary, and you can see that there are large vessels that we'll see on the multiplanar image that course toward the center of the lesion. And this is apparent here as showing you all these large feeding vessels into the center of this metastatic ovarian lesion. So what we have here are multiplanar images of an ovary with central vascularity. And here are the vessels inside of the ovarian lesion, showing abnormal branching patterns. So here are the vessels inside of the metastatic lesion. This is a lesion that has large central vessels, and as you can see, it's a tubovarian abscess, but it points out how we can use 3D to monitor where a needle would pass if an interventional procedure is done in this patient. Here's the large ovarian mass with the central vessels feeding the walls of several small locules. And by sculpting and doing so-called electronic bloodless surgery, we can see inside the lesion. So we took the top off and are now looking down into the lesion. We can see the locules that are present inside the lesion, and these would contain perhaps a few cc's of pus, but the needle would have to traverse the large vessels to get to them, and therefore was not a very good idea to try to aspirate and get the very small amounts of pus inside of this ovarian lesion. So now we'll go back to where we were and put the tissue back bloodlessly and get out of the tubovarian abscess that I've shown you. So with 3D we can do multiplanar imaging, and we can see these central vessels inside of ovarian malignancies. And this is a grayscale image now using 3D showing the abnormal branching patterns of the tumor neovascularity.